And we are back with Dr. John Kressel of Phoenix Cyberknife with one of his patients, Dr. Myron Mike Kays. He's joining us this morning, and I know he has a lot to tell us about his treatment. But first of all, Dr. Kressel, we learned about Phoenix Cyberknife earlier, but tell us why Mike came to see you. What happened?
Well, he's a unique patient. He'd been through a number of things. He's got a number of different tumors. He'd been treated for lung cancer. And it came to me for follow-up after being treated for lung cancer with a different form of radiation therapy. And then in the course of follow-up was diagnosed with prostate cancer.
Wow.
And then asked in the process of being diagnosed for that if he could be treated with Cyberknife for his prostate cancer. And in the course of that, we ultimately decided, or he decided, to be treated with Cyberknife for his prostate cancer, and now is in follow-up for both of those malignancies and appears to be disease-free.
Oh my gosh, congratulations, Mike. That
Thank
must
you.
make you feel amazing. So you know.
Congratulations to him, too.
Well, to both of you, really. I mean, so Mike, you've had experience with other forms of radiation.
Yes.
So tell me the difference, and what was it about Cyberknife that you convinced Dr. Kressel to
My
take
second
you on?
diagnosis with lung cancer resulted in the need to have stereotactic radiation. And I did, and fortunately it was successful, but as I had that, it occurred to me that a patient lying on a table with a stationary machine having a spot in a lung treated while he's breathing during those 20 or 30 minutes of treatment was not the best idea. And so I became curious what other opportunities there were. In addition, I was unhappy with the office that I had been seeing. So I found Cyberknife and I asked Dr. Kressel to do continued and follow-up care for me, which of course he did. And then, as he noted, a couple of years later, I was diagnosed with prostate cancer, and there was no decision to be made.
Right, right. You'd been there, done that. Now you knew. What was your experience like at Phoenix Cyberknife? Now that you know what it's like in other places, obviously you were happy, and tell people what you felt.
I'm thrilled with the office. I'm thrilled with the fact that I have a doctor who really cares, whose appointments are largely on time, whose office is filled with competent and cheerful people. And then ultimately with a procedure that made an enormous amount of sense, and by golly, it worked.
Oh, congratulations to you, Mike. Congratulations. And Dr. Kressel, you want everybody to know you take all forms of insurance, is that right?
Yes, ma'am.
Okay, we just got to make that call and make that appointment. And what about different types of cancers? Can you treat all types of cancers?
It's very versatile, yes. I mean, it's not for everybody,
Okay.
but we do treat basically from head to toe. And it is a technique that's very useful for many cancer patients in different stages. It's not, it's not only just early stage, but sometimes also very advanced stage or after prior therapies that they've gone through before, whether it's surgery or chemotherapy. So it's a very powerful technique that many patients can benefit from.
Right, and as we said in the earlier segment, it's all about doing your homework and learning what your options are. So, Mike, thank you so much for sharing your story.
You're very welcome. I hope people are listening and pay some attention, and at a minimum, check it out.
Right? Right. That's what you can do for yourself, right? All right. Thank you very much to both of you. If you have any more questions for Phoenix Cyberknife and Radiation Oncology Center, you can email them. It's info@pcroc.com. Here's where they're located, 4611 East Shea Boulevard. That's in Phoenix. You can also call them at 602-441-3845. Learn more, visit the website. It's phoenixcyberknifecenter.com.